So this was a patient who arrived with inferior wall MI and RV myocardial infarction, and as you can see, the patient has been put on a temporary pacing wire, and you can see here where the mouse is pointing at that there is an 100% total occlusion of the right coronary artery. This is the temporary pacing wire. The patient had a heart rate of about 36, 35, 36, basically less than 40 heart rate beats per minute, and a pacing wire was put in through the right femoral vein, and the ventricle was paced at a rate of about 70 beats per minute. So initially we started wiring with a BMW wire, but the BMW wire would just not go through. So we changed our strategy to a whisper extra support wire. As you can see that from the catheter, this is the catheter, this is a JR 3.5, and we are using the whisper wire here. After the whisper wire, we have 2 mm balloon here, and we're trying to daughter the balloon. Daughtering is basically when you're starting to move the uninflated balloon back and forth just to see whether you're in the correct vessel or not, because if you're not in the vessel and you inflate, then that becomes a huge problem, because you might actually end up having a large perforation. So we have inflated the balloon now, and we can see that after the inflation the vessel has opened up really well. So we've given some NTG, we are pre-dilating the vessel some more. After the nitroglycerin NTG shot, this is the vessel that has come out. Some thrombus was being formed, so we're doing some aggressive pre-dilatation. So now we are inflating with positioning the stent. So the stent is being inflated here. As you can see, we try to inflate the stent for at least 20 to 30 seconds so that the stent opens up really nicely. We have pre-dilated the proximal vessel with the stent balloon only, so that we can also measure this way. So next we have inflated the stent, keeping a margin of about overlap segment of about 3 mm. Pushed the balloon a little bit inside so as to cover the overlapped segment. Again, covering the overlapped segment with the stent balloon only. Now some post-dilatation. So please remember that the stent size used is 3 mm, proximal and the distal, and we're doing some aggressive post-dilatation. Post-dilatation is very important so that good lesion opening can be achieved. The stent has opened adequately. Yes. So we're post-dilating it with a 3.5 mm balloon. Okay. Wonderful, wonderful. And as you can see, the final result. Wonderful open artery, primary PCI, So let me just show you the first image and the last image, the final chart. This was the first image. You can see 100% locked RCA, and while you can, I think, appreciate that the RCA has opened up very nicely in the final shot, and the patient is doing well, and I think we'll be removing the TPI by in 2 or 3 hours. Thank you. Agra Heart Center.